giving our weekly update on COVID-19, the coronavirus pandemic. As we end September, we've been very, very pleased that this community throughout the month of September has had a very good month with respect to the numbers, the percentage of positive cases, et cetera, et cetera. So the cooperation from the community, again, as we entered school, the school season, school sports activities, et cetera, youth sports, really the community continues to be very, very cooperative over working together, wearing our masks, physically distancing, all those type of good things that we know we want to continue to do. In a minute, Dr. Bogan's going to give the report. I just want to touch on two things very quickly. Operations that we have talked about in the past. The census, whether it ends today or just in a couple of days, we're not sure, there's court cases, things like that. But again, we can be proud in Allegheny County. In the country, the response rate has been 66%. In the state, the response rate has been 69%. And here in Allegheny County, the response rate has been 72%. So very proud of the fact that, again, people cooperate, people are doing it. We want to run that number up even more. And it has to do with a lot of funding that we would be able to get, formulaic funding on transportation and health and education and things that the federal government is able to give to different communities, but they give it out based on population. So we want to make sure, again, everybody is counted. The other thing is obviously we're in election season. We want people to be safe. We know over 300,000 of our fellow Allegheny County residents have applied for the mail-in ballot. The mail-in ballot is what you're hearing out there. It's probably the best way to do it. It's easy. You can do it in the privacy of your home. You can vote at home. You still have time to apply online or apply by mail, but we want to make sure that people are safe. Obviously, if you want to go vote on Election Day on November 3rd, you'll have that opportunity. There's also been satellite locations as well. But again, we want to keep people safe and give people the opportunity to participate in our democratic process and do it in a safe manner. So anyway, with that, let me turn it over to Dr. Bogan to give her weekly report. Dr. Bogan.
Thank you, County Executive, and thank you all for joining us again today. So I am really happy to report that our daily case counts have remained relatively stable and quite low. Honestly, I had expected to see a surge in cases in September as our schools reopened and colleges returned, and I'm thrilled that we've had a relatively quiet September. I really attribute that to the hard work of our schools in developing safe plans for returning students and the hard work by our community to continue to take steps that keep us all safe, like mask wearing and physical distancing. I do want to make one note about today's numbers. We saw for the first time more probable cases than confirmed cases. And this is really due to an increasing number of antigen tests being conducted in our county. So I just want to remind people, antigen tests look for pieces of the proteins that are part of the virus, and they can tell us if you have an active infection. They're easy to perform and can produce rapid results. They're being used in our long-term care facilities, by our sports teams, and a couple of our universities. And there are actually a handful of health clinics in the county offering them too. And again, I expect more and more antigen tests to be used in the coming weeks and months, so the number of probable cases will likely increase. So a person with a positive antigen test is considered probable by the state, but that doesn't really impact how we treat them. Just like a confirmed case, they are instructed to isolate, and they undergo case investigation, and their contacts are contacted by our contact tracing team. So, and one other point about antigen tests is that they are not used to determine our positivity rates, but their presence in NEDS in our database makes calculating positivity rates a bit difficult. So if you are curious about our Allegheny County positivity rates, the best resource is the state's COVID-19 Early Warning Monitoring System dashboard. Our county positivity rate on that dashboard is currently 2.9% and has been falling. I also wanted to talk briefly about our testing site. So as you know, we opened up the community test site in McKeesport a few weeks ago, and to date we have tested about 400 people. Last week, we tested 170, and the positivity rate among those tests has been about 4.5%. I also want to remind you that tests are free, it does not require health insurance, and it does not require a prescription from a doctor. There are plenty of slots available, and we make same-day appointments by phone, and you can make appointments for the next day on the website. This test is really comfortable for children. We've tested quite a few young children, and we really are not turning people away. So if we have actually relaxed our criteria for testing, so if you're concerned that you could have COVID-19, I want you to get tested. Just come to our McKeesport test site. We are also looking at changing hours to accommodate more people. So I know that offering from 10 a.m. to 4 p.m. Monday through Friday doesn't work for everybody. So I hope next week to report some increasing hours for evenings and weekends. So stay tuned. An important reminder is that any restaurant wishing to operate at 50% capacity must complete the state's self-certification process. And starting Monday, the health department's COVID field response team will start basing assessments of capacity on whether a restaurant has certified or not. So I know that everyone has a lot going on these days, and believe me, I really try to keep these remarks as short as possible. But I wanted to spend some time today getting back to the basics. What do we know about the virus that causes COVID-19? How does it spread? And how do we use this information to make the well-informed decisions for ourselves and our community? So the virus that causes COVID-19 is called SARS-CoV-2. The virus is spread primarily by droplets that escape from our nose and mouth when we breathe and we speak. When we sing, talk loudly, yell, cough, or sneeze, we increase the quantity of droplets we expel and the distance those droplets can travel. And when these droplets are inhaled or land in the mouth, nose, or eyes of someone else, that person can become infected. Now we know that viruses spread in other ways too. They can spread by touching contaminated surfaces, and when you touch your hands then to your mouth or nose, you can get transmission that way, and that's called fomite transmission. They can also transmit through aerosolization, which is when tiny virus particles linger in the air for a long time, remain infected, and then somebody inhales those, and that's called aerosolization. And actually, aerosolization is how measles is able to spread so effectively and efficiently. Both fomite and aerosolization transmission are possible ways that SARS-CoV-2 can spread, but these are not by any means the primary way. The data really strongly suggests that droplet spread is the main way, which is the basis for our recommendations around mask wearing and physical distancing. So, because the virus spreads by droplets, we strongly recommend the use of masks or face coverings. The material of the face coverings helps stop those droplets as they leave our mouth and nose from traveling and landing on someone else. Masks work best when they're comfortable and they fit over the nose and under the chin without large gaps, thus trapping the droplets inside the covering. So why do we have to wear face coverings all the time when we're near other people? It's impossible to know if you have the virus. At least 40% of people with the virus never develop any symptoms, and many more have mild symptoms that they can easily dismiss. People who eventually do develop symptoms can spread the virus for a day or two before they feel sick, and so to be sure, so you just can't be sure if you have the virus. So it's important to wear a properly fitting mask or face covering when you're near other people who are not part of your household, regardless of the size of the gathering, and whether you're indoors or outdoors, or whether you feel sick or you feel well. If you feel sick, you shouldn't be around other people. I'll just throw that in there. Is it true that masks don't always work? Like many things in life, masks are not perfect. The effectiveness really depends on how well they fit, the material, and the comfort, so you don't fuss with them. But they can be quite effective, perhaps over 90% effective at reducing spread. But really, that's not perfect, but pretty darn good for a low-cost, widely available, and pain-free strategy. There's some evidence that the face coverings not only protect other people, but they offer the wearer some protection as well. But because their effectiveness is not perfect, they should be combined with physical distancing. And when you do combine both face coverings and physical distancing, you greatly reduce the spread of the virus. Remember, you have to be close to someone for their droplets to possibly expose you. You've heard people say like 6 feet, but that's really the minimum distance and is a good one for outdoors. However, indoors, when possible, consider even further distancing if you can. So we are quite good at wearing masks and physically distancing when we're around people we don't know, like waiting in line at the grocery store, dining at a restaurant, or watching our kids play sports. But we tend to let our guard down when we're around people we know well, like family and friends. We can't imagine that someone who looks healthy, who we know well, who we trust, could possibly have the virus, and we just tend to get close, which is why we have and we continue to have reports of spread at family picnics, graduation parties, weddings, funerals, and other events where people know each other well. Interestingly, we see very little spread from outdoor gatherings where people don't know one another well. So I'm not saying not to see your friends and family. I'm suggesting that gatherings with friends and family should look a little different. Keep your celebrations small and outdoors whenever possible. If you can't resist that initial kiss or hug, do it briefly and while wearing your mask or face covering. Wash your hands before and after, and then continue your visit physically distanced and seated at least 6 feet apart outdoors and further apart indoors if it's possible. Staying seated keeps you from gradually moving closer together, which we all like to do when we're with our friends and family. If you serve food, again, have one person serve and have everyone seated to eat, not standing close together. And put your face masks or coverings back on when you're done eating. I'd also encourage you to consider limiting alcohol to modest amounts so that people don't lose inhibitions that come from larger intakes of alcohol. So these are things you can all do and we can all do around us to stay safe. We're not doing them because you think you have the virus, you're doing them because you care about yourselves and others. So I know this takes a really conscious effort, and it's not human nature to stay physically apart. We're used to kissing and hugging as part of our greetings, both saying hello and goodbye, but we have the capacity to change when we understand the rationale behind the need. So again, we are beginning to see the emergence of fall allergies and cold viruses, so I want to encourage everyone to go get their flu shot soon. Our health department has plenty of vaccine in our immunization clinic. Most of the pharmacies are well stocked, and many doctors' offices are also getting it. So with that brief review, I want to thank you all to encourage you to stay safe and be kind. Thank you.
The first question that we have is from Public Source. CDC Director Dr. Robert Redfield estimates that 90% of Americans have not been exposed to the COVID-19 virus. Is this an estimate, Dr. Bogan, that you believe holds for Allegheny County?
The CDC is in the process of studying how widely the virus has spread and has some preliminary results which suggest about 90% remaining susceptible to the virus. Here in Allegheny County, I think that number is a little bit lower. We have about 1% of the population who've had a case, been identified as a case. And our tests are about 15% of the population. So I like to estimate, and again, this is really just an estimate, that for every case we've identified, perhaps there are 5 cases who weren't identified, which would put our county somewhere at the 5 to 7% is a best guess. So regardless, whether it's 5%, 7%, or 10%, most of our community remains susceptible to the virus.
This next question in multiple forms is coming from multiple outlets. What are your thoughts on the Steelers and Pitt wanting to add fans during games? The questions include, what are your concerns? What are your thoughts about limits? Have you spoken with either of the teams, and will the department be involved in this decision being made by the Pennsylvania Department of Health?
I'm going to let Mr. Fitzgerald answer that one.
Thank you, Dr. Bogan. Well, first of all, the very first is, this is a decision that will be made by the state, by Secretary Levine and Governor Wolf and their team. who, quite frankly, have done a great job throughout this entire pandemic. We have lots of discussions, both locally and statewide, with many organizations, with many, we talk to the Restaurant Association, we talk to the financial situation, retail, construction, manufacturing, and a lot of individual organizations that have specific needs. It could be an entertainment venue of some sort or another. So we do have those discussions. And we have had discussions with some of our sports teams. We've had some of our discussions with our universities, and our universities have been tremendous partners throughout this whole thing. I've mentioned that before, particularly our biggest university, University of Pittsburgh. Sports is obviously a very important thing to a lot of us, to this whole community. It's part and parcel of who we are in Western Pennsylvania. We've gone through this with high school sports this year. Many parents, many teams that were able to participate and can participate safely. Thus far, we've seen fairly good results when it comes to that. There have been some outbreaks here and there where teams have had a number of tests and they've shut down for a couple of weeks. They've isolated and quarantined people for a couple of weeks. Our Major League Sports, two of our Major League Sports teams have finished their season. The Penguins and the Pirates were able to do so relatively safely. They did so without fans. There now is a talk of discussion about what about college sports? What about college football? What about professional football? There's two different levels, I guess, with the University of Pittsburgh. There would be the level of the parents and close family members at Heinz Field. And we've seen, again, at the high school level where they have 250 fans, parents can come, family members can come, physically distant, all that type of thing. But then there's the next level of, do you allow thousands of fans into the game? And if you do, how do you do that? And I think those are discussions that are worth having. As Dr. Bogan talked about, the mask is so critical, 90% effective, and some people even think might even be more, along with the physical distancing and along with staying away from people. So can you have thousands and thousands of fans in a stadium wearing their masks the whole time for 3 hours, 3.5 hours for a game? That becomes a question. The distance, and Dr. Bogan talked about 6 feet as a minimum, and when fans are at a sporting event, they like to cheer, they like to yell, they like to, and maybe 6 feet isn't enough. So you look at all these different factors, but with Dr. Bogan and her team and Dr. Levine, Secretary Levine, have done a really, really good job of keeping us safe. And I think they're going to continue to take a look to see if things can be done safely. We understand there's going to be a lot of folks who want to push the envelope. And let me just give a couple of examples. Very early on in this pandemic, back in mid-March, Pennsylvania had a really difficult time, particularly eastern Pennsylvania, the Philadelphia area and surrounding areas where cases really shot up very quickly. We had a very, very high death count early on in Pennsylvania. Governor Wolf, once they took action, when they got a hold of the information with Secretary Levine, started to shut things down and do a really, really good job. So if I go back a few months and I look at the total deaths in a state like Florida and in a state like Pennsylvania, Pennsylvania probably was around 6,000 fatalities that had occurred, and Florida at the time was maybe 5,000. Well, look at the numbers now. Florida's approaching 15,000 fatalities, and Pennsylvania's around 8,000. 8,000 is too many. 15,000 is certainly too many. So other states have made decisions to open things up. Some of it is sports, some of it is entertainment, some of it's recreation, et cetera, et cetera. But the fact is, these decisions are very difficult decisions, and they will be made in a very serious way. So when Governor Wolf and Secretary Levine convene with, whether it's the Eagles and Temple University or Penn State University, some of our bigger collegiate sports football teams, our professional sports, they're going to do so with science and health in mind. And I think one of the things we have learned throughout this pandemic is if people are cooperating, meaning wearing their masks, staying physically distant, staying, doing the mitigating factors with washing your hands, doing the things that can be done, they can be done safely, whether it's the workplace, whether it's school, whether it's even recreation, getting together. So I think the state will certainly take a look at that. I'm going to be supportive of Governor Wolf and Secretary Levine as they continue to move forward. So these discussions will continue, and I think we'll see where that all goes. But ultimately, it won't be a decision that's made here at the local level or in Philadelphia. It will be made by Secretary Levine and her team.
This next question is from KDKA. What are the county's thoughts on the Catholic diocese easing restrictions for masks by allowing up to 50% capacity rather than the 25% capacity it had been at?
As we've been saying, we can do lots of things safely, including going to religious gatherings. We know we've had just a small number of cases in the county in the last 4 weeks, I think about 10 of cases who've reported going to religious events. But I think you can do it very safely. And again, wearing masks is part of that, keeping physically distanced, and churches and other religious organizations know how to do this effectively. I will remind people that singing was one of the early cases we had here and other places. Singing actually is a pretty good way of spreading the virus. And so I encourage people to keep their masks on and keep physically distanced as they attend their church services.
This next question is from the Tribune Review. Are you able to share what portion of new cases in September were among college students in the area or linked to the return of college students?
Yes, I have that information. Give me a second. I want to say that there have been about 325-ish cases among our college and university students, which is exceedingly low compared to other places. So again, our colleges and universities have done an incredible job, and that is really over the last 4 weeks. And so in that same amount of time, we've had about 2,000 reported cases, so it represents about 15% of our cases, roughly.
With our positive test percentages well over 5% for weeks now, isn't that an indication that we should be testing more?
So I'm going to answer that in 2 parts. Yes, we should be testing more. That is one of the reasons we've opened the McKeesport test site. I also understand a question may have come in about how have we relaxed our criteria for that test site. So we were initially really strictly adhering to the CDC guidance that you either had to have symptoms or you had to be a close contact. But we got a lot of requests for people who were told they couldn't return to work without being tested, or that they come back from travel or concerned. So we've allowed now people who have concerns that they could be exposed, they went to some event that made them concerned, or they're returning from travel or things like that. I do want to remind employers and other people who are requiring people to get a negative test. We have had a number of requests saying, my employer isn't letting me back to work even though I've completed my 10-day isolation without a negative test. And I just want to remind people the CDC does not recommend a second follow-up test. If you've been tested positive, when your 10 days of isolation are over, you don't need to be retested to go back to work because those tests can remain positive for quite a while. The second part of the question was about positivity rates. So again, I don't think people are often using positivity rate. It's confusing because what we report on our website is numbers of individuals tested, not the total number of tests, where the state on their website reports the proportion of tests that are positive. So I strongly encourage you to go to the state website for our positivity rate, not using what we report on ours again is falsely high based on we're looking at individuals tested, and people get tested multiple times. So for instance, they're testing people multiple times at long-term care facilities. And again, somebody can test 4 times negative, and then they come back for a 5th test. Over the last 6 months, they've been tested for various reasons, and then the 5th test is positive, then that person's counted only once in our report. So again, our positivity rate on the state website today was, I think, 2.9%, so very low.
This last question is from public source. UPMC health officials yesterday said that they would continue symptomatic COVID testing during the influenza season. Given that COVID symptoms frequently mirror those for the flu, how much do you believe testing will have to ramp up for the influenza season?
So I think that we'll have to increase testing because more people will have symptoms. And I also think, as I mentioned earlier, that I anticipate the types of testing that will be available in our community will change and will continue to change. So one thing I've learned about this virus and this pandemic is if you look too far ahead, things change so quickly that it's hard to make predictions. But I'm pretty sure that we'll be having more and more point-of-care testing. Just like you can do a rapid flu test in an urgent care, you can do a rapid flu test, you will be able to do rapid COVID tests in our urgent care centers and many of our doctors' offices in the near future. And that will change the availability of testing, the rapid return. So many of those tests can be return results in 15 to 30 minutes. So I'm sure that testing will ramp up over the winter, but it may not be PCR tests that take 2 to 3 days to come back.
And that was the final question. If there's any closing remarks.
Well, thank you again, and you know, the team that Dr. Bogan and her team, you know, continue to work very diligently day after day throughout very difficult situations to keep us safe. And the strategies that she has employed and we have all employed and we've all cooperated with have kept us in a pretty good position. So September and August and September, after a pretty tough July, we've seen the numbers stabilize and continue to be good. And again, as we go in more indoors, as the weather starts to change, the same strategies of wearing our mask, keeping physically distant, and following again the strategies we know work. From Dr. Redfield to Dr. Birx to Dr. Fauci to Secretary Levine, Dr. Bogan, all of our medical experts are on the same page and agreeing on where we are. So let's continue to cooperate. Let's continue to keep each other safe and have a good week. Thank you. God bless.